All right, we're here with Cody from the dermatology specialist, and we're going to hear all about neurotoxins. We're here today giving out Dysport injections. Cody, tell me a little bit about what types of neurotoxins you offer in the clinic, what you recommend, how you determine which neurotoxin to give them.
So we've got a handful of toxins that we can use. We've got Botox and Juvo, Xeomin, and then Daxifine. In terms of what I might select for a patient, it just depends on maybe the patient has a preference. Maybe they've had a good experience with the toxin in the past, so we'll choose that one. Or maybe they'll leave it up to me as the injector. So based on the patient's concerns and what they're kind of wanting, that's how I'll decide. Each of the toxins, they're all pretty similar, but some of them work a little bit differently, or maybe you'll get a little bit longer length of time with the other ones.
When you're using neurotoxins to treat patients, are you almost always using them for cosmetic procedures? Are you sometimes doing medical procedures for things like hypohidrosis?
Great question. Yeah. So not only are neurotoxins used for cosmetics, to soften the wrinkles of the face in various locations, but we can use it medically. You had mentioned hyperhidrosis, which is just excessive sweating. We have it approved for under the arms. We can also do it into the palms and the soles. Outside of that, you can do it into the masseter muscles, so into the jawline. And what that does is a few things. First of all, it'll soften someone's clench. So if they're grinding their teeth at night, it'll soften that. And then it'll also give a nice slimming of the jawline, which some people like because they feel like they have a very block face. And then we can also do it into the traps. So if somebody has a lot of tension and they constantly shrug up their shoulders, sometimes they'll have headaches. We can do it into this area as well, and that releases that and relaxes the shoulders.
That's amazing. Mewing hasn't worked for me, so maybe I should try that out. So tell me, how soon can people start to expect results when they get a neurotoxin injection?
So neurotoxins, unfortunately, they don't work like that. They do take some time to kick in. Dysport, which is what we're focusing on for today, is the one that works the fastest, generally speaking. You can see it start to kick in usually about 3 to 5 days. The rest of the neurotoxins take a little bit more time, 7 to 10 days to see the full results. And then frequency, it depends on the toxin. So most of our toxins, we suggest getting the injections done every 3 months. One exception is Daxify, one of the newer toxins. That one is advertised as lasting 4 to 6 months. So that one is a little bit less frequent in terms of injections.
Nice. Amazing. Anything else that people need to know, things to look out for? If they have any kind of reaction, they should come in and see you.
Yeah. So I'll start with your second question. Botox, neurotoxins in general, are super safe. People will always come in and say, I don't want to look like I'm in Hollywood. But with neurotoxins, they really don't make you look too different. They just make you look a little bit more refreshed and a little bit more rested. So there's no major side effects when we're injecting such a small quantity into the face or into the jawline. Relatively easy. The most common side effect is maybe a little bruise in one of the locations, but other than that, nothing too major.
So if you want to look like this instead of this, and you don't have the genes, maybe try some neurotoxins. Thanks so much, Cody.
Yeah, thank you.